Hi, welcome to Ames Responds to COVID-19. This is a question and answer program where Ames area organizations are available to answer your COVID-19 pandemic questions. I'm Susan Guiasa, the Public Relations Officer for the City of Ames. We have several questions that have come to us this week, and we have several organizations ready to respond. If you have a COVID-19 related question, please call our city hotline at 515-239-5670 or email us at covid19@cityofames.org. And we will try to get your question on our next show. Our first question came this week. It probably applies to many people. Question: my income has been affected by the pandemic, and I'm worried about my ability to pay rent and utilities. Is the city considering anything that could help my situation? That seems like a good question for Vanessa Baker-Latimer, the housing coordinator with the City of Ames. Vanessa, what can you tell us?
Thank you, Susan. The city was fortunate as being an entitlement community. We recently received $354,515 from the federal government to implement a COVID-19 CARES Act response program. And we have been gathering public input as to what was the greatest need that we could utilize these dollars for. And we recently just finished writing our action plan to implement a rent and utility assistance program and a mortgage and utility assistance program for those families and households that have been affected by the pandemic in their loss of income or income reduction, and they're in a position where they could be evicted or foreclosed on their homes or their rental units. So that is one of the programs that two of the programs that we're looking at in this first round of initial funding.
So it sounds like you're pretty early in the process. If somebody is interested in this program, what should they do?
Well, our program has to be approved first by council, which will happen on Tuesday, June 9th. And then once they approve the program guidelines, we will submit our action plan to HUD. And it's anticipated that they will do a quick turnaround to approve it so that we can receive our grant funds. From there, we hope to have applications available on our website at www.cityofames.org/housing. There will be a separate application for rental households and a separate application for homeowner households. And a lot of the information and process of the program will likely be online until due to the pandemic and also until City Hall reopens. That will be the major spot where you will be able to access the information.
So again, Vanessa, it sounds like if somebody needs assistance, they should simply wait until the information is available on the website.
Well, we would hope to help as many citizens as we can in Ames. However, there are people that have been affected longer than what we can get the dollars through. And I would recommend people to check the state of Iowa's website. The governor has also implemented a program to help renters and homeowners that may be up and running quicker. And so if they're in a situation where they have already received their eviction notice, I would suggest that they go to the state of Iowa website, the Iowa Finance Authority at www.ifa.org, and look for possible assistance under that program.
Thank you. So two great options to look for. Our next question is more general and definitely healthcare related. Question: in these uncertain times, do healthcare workers in Ames feel appreciated? Are they aware that people are deeply grateful for their commitment and dedication? And are there things we could do that would make life easier for them? Steve Sullivan is with us today. He's the Director of Marketing and Community Relations for Mary Greeley Medical Center. Steve, do you have a response to that?
Yeah, I believe yes. Speaking on behalf of Mary Greeley, I believe our staff feels very much appreciated. Since the beginning, we've had an outpouring of support from the community. I think food from just about every available restaurant in Ames has shown up on our doorstep, either through the courtesy and generosity of the restaurant itself or through another organization which has purchased a meal, which has been shared with primarily with our frontline staff. We've also had a number of organizations create personal protective equipment, PPE, for us. For example, Iowa State University's Cirrus program was able to fabricate face shields, as was the John Deere company. So that has really helped to extend our PPE. We've had more than 300 people sew more than 5,000 masks for us. We are awash in masks around here. We've also had just statements from people, sometimes via social media. There are people who have written chalk messages outside of the hospital that staff see when they walk in. So yeah, I do believe that our staff feels very much appreciated and thought about during this very uncertain and challenging time.
And is there anything you'd recommend people do, or do you think just keep on doing what they're doing?
Keep on doing what they're doing. Heed the advice from healthcare. Social distancing is still important. Washing your hands is always important. And wearing a mask is still an important act, especially as we open up. We don't want to see COVID patients. We hope we can stem the spread of this virus, and those are steps that we're practicing when we're out and about, and we hope other people do as well. Other than that, just remain patient with us as we're working through visitor restrictions, and we appreciate these are very difficult things we have to put in place here. Telling someone they can't visit a new baby, for example, is hard on staff, and we understand the concern that causes for folks. But right now, we have to have those things in place, both for the safety of our patients, our staff, and our visitors.
Well, that's some great advice for people on what they can do, both for showing appreciation and to keep themselves safe. And remembering that the frontline healthcare workers really don't want to see them because they want us all to be healthy. Our final question goes to Corey Mellies with City of Ames Fleet and Facilities. Here's the question. I read city facilities were starting to reopen. What are you doing to ensure citizen safety when we enter buildings like City Hall? Will anything be different?
Yes, definitely. I think when the public first comes to City Hall, if we open on July 1st, which is the current plan, then we'll see a lot of differences. Probably restricting the amount of entry points in the City Hall, directing customers to maybe one entrance. Probably like a lot of areas, you'll see maybe an entrance and an exit and one-way signs to get people to allow that social distancing as they walk in. Once they come into the building, they'll see the reminders about keeping social distance. You'll see a lot of sneeze guards or plastic barriers between the staff and them to kind of keep them both safe. They'll see city staff if they're walking around City Hall. They'll be wearing a mask. That's our current policy, which will stay in place. It might be recommended for customers to do that. They'll probably also see more hand sanitizer and things like that for them to use as they come into the building.
So I know people think about City Hall when they think of city facilities, but what are some of the other buildings that you're assessing?
Yeah, so we have a lot of our utility buildings where we do get some public interaction in all those buildings. We've been coordinating with the library. We'll have discussion with Parks and Recreation as they start to open, whether it's in City Hall or other facilities, things like the auditorium that are in City Hall. So we'll have a lot of coordination throughout the city. We're also looking kind of at our employee level, trying to make sure our employees are safe. If they don't have that distance, what can we do for those employees? So there's a lot of work to be done, a lot of coordination.
And again, that date for City Hall reopening?
July 1st.
July 1st. All right, thank you. I want to thank our panelists of experts, Vanessa Baker-Latimer, Housing Coordinator with the City of Ames, Steve Sullivan, Director of Marketing and Community Relations for Mary Greeley Medical Center, and Corey Mellies, City of Ames Fleet and Facilities Director. Just a reminder that Ames Responds to COVID-19 is an opportunity for you to ask questions relating to the pandemic. Is there something you're curious about? Please call us on our city hotline, 515-239-5670, or send us an email at covid19@cityofames.org. Just one final note, the spring no charge yard waste day, something that here at City Hall we get a lot of questions about. that has been rescheduled to Saturday, June 27th. So participants need to know they'll be safely socially distanced if they participate in this, so there may be a longer wait. So it will take longer to drop off your yard waste. Please see our city website for more details. Also, please remember we are living in rapidly changing times, so the information presented on this program is accurate as of today, but it could change. Please remember to check reliable news sources for the latest information, including our City of Ames COVID-19 website, cityofames.org/COVID-19. Thanks for watching Ames Responds to COVID-19.